Recent reports have found that about 1/3 of Australians don't go to the dentist because it's too expensive or too hard. Even for people who have secure jobs and regular income, getting a checkup can often be painfully expensive. So for many people who live on the streets or don't have much money, a visit to the dentist is the last thing on their mind. But in South Australia, dental and oral health students are now working alongside a program called Streetlink to help put smiles back on the faces of young people in need.
Yeah.
For some Australians, parks, tents and benches are home. More than 100,000 Aussies are homeless, and research shows that about half of those are under the age of 25. And when they're living rough, their health and their teeth can often be neglected. Alan knows just how tough it can be.
Within the last couple of months, I've had some issues with my wisdom teeth. I think the bottom two are, perpendicular and coming out. I've had some really nasty pain with that. One of them, I think both of them started bleeding.
And Alan's not alone. Tom from the Streetlink Youth Service says many people leave pain untreated because of the cost.
If you're homeless and you're living rough, or you're living in a hostel of some kind, washing yourself, cleaning your clothes, are fairly low on the list, and oral hygiene comes even lower than that.
And that can lead to more problems.
If you've got a tooth missing, or if you've got gum disease, and if you've got bad breath or other issues relating to poor oral hygiene, the impact that it can have on your self-esteem is massive.
Now, final year dental and oral health students from the University of Adelaide are helping young people out.
We recognised there was a need in the community for homeless people and people at risk of homelessness, that their dental health was really poor and that often access to services was really difficult.
Carl is one of the student dentists.
Well, today's fairly simple. We're just having a look, checking up their teeth and their gums to see if they're healthy or not. And later on, we'll look at possibly doing some fillings or whatever they need. Alan? Hi. My name's Carl. I'm going to be looking after you today.
Cheers.
Come on through. Basically, all we want to do today is just have a look at your teeth, see what's going on, and we'll talk to you from there about where to go from here.
Alright.
Okay? First thing we've got to do, though,
After a look at Alan's teeth, it's agreed that he probably does need his wisdom teeth removed. But before anything can be done, his swollen gums need to settle down. Oral health student Jackie is here to give Alan some tips.
With the inflammation in the area, it's really important that you use the toothbrush in the area for a little bit longer, but don't be forceful in that area. So if you come from the side, right down low, really nice small circles.
You're living on the street. By the time you've got to do what you had to do, you just wanted to go to places and get breakfast and have a shower. You weren't worrying about brushing your teeth. You just it was just a time flow. You had to be in. You had to have a shower within the 4 minutes, otherwise your water would just cut off. So no matter how much you tried, you just forget a lot of things, like living the way we were. Surviving was the priority, yeah.
The Streetlink dental program doesn't just benefit the patients, it's also a big help for the students.
For personal development, it's a huge plus. We do get to see a lot of patients who come from a broad perspective of communities and things like that, so it is really good for personal development as well as clinical skills.
well, you get a lot of great experience here. I think it'd be really good for dental students around the country to get a chance to try something like this if they got the opportunity. It's something that'll really help you for your future career as a dentist.
Earlier this year, the government announced an investment of $4 billion over the next 6 years to make sure all kids and disadvantaged people get access to the dental care they need. So hopefully there'll soon be more programs like this, and dentists will be able to change more lives, one mouth at a time.